We all know how important it is for our pets to stay hydrated, right?
Yeah.
That water bowl always needs to be full. But what happens when that simple balance, fluids and electrolytes, kind of goes sideways? Today on the deep dive, we're looking into something surprisingly complex. Hypernatremia in dogs and cats.
Mm,
Basically, what happens when sodium, just plain salt, gets too concentrated in their bodies?
exactly. It sounds simple, but it's really not. We've been digging through some detailed veterinary references on this. Our goal today is to sort of unpack what causes this high sodium, what signs you might actually see at home, and why it can be pretty serious. We want to give you the essential info without, drowning you in super technical terms.
Okay, sounds good. Let's dive right in then. When we say hypernatremia in pets, what are we actually talking about? Is there like a specific number?
Yeah, simply put, it means there's a higher than normal amount of sodium in the blood. For dogs, we usually say anything above 158 milliequivalents per liter. For cats, it's a bit higher, above 165.
Okay, 158 for dogs, 165 for cats. So too much sodium floating around. Why is that such a big deal for them?
Well, sodium is really, really important for managing the fluid outside of their cells. So when sodium levels shoot up, it usually means the whole body's fluid balance. The technical term is osmolality is, well, it's out of whack. Think of it like the concentration of everything dissolved in their body fluids. High sodium throws that concentration way off.
Got it. So it's not just the sodium itself, but how it messes with that critical fluid equilibrium. How does that usually happen? What are the main ways pets end up with this?
Right. There are basically three main pathways. First, they lose too much water. Simple as that. Second, they somehow take in way too much sodium. And third, it can be, a mix of both. It's worth noting this mainly impacts their endocrine system, think hormones and metabolism, and their nervous system. And yeah, it affects both dogs and cats. So fundamentally, it boils down to not enough water compared to sodium, or too much sodium compared to water.
Okay, that basic balance makes sense. Let's dig into the why a bit more. You mentioned the sources break down the causes.
Yes, they do. It helps to think about it in categories. Let's start with cases where the total amount of sodium in the body is actually high. Now, this is less common, but it can happen. Rarely, a pet might eat a huge amount of salt. Very unusual, thankfully. Or sometimes during emergency vet care, they might get too much IV saline. And in really rare cases, certain hormone problems like hyperaldosteronism can make the body hold on to too much sodium. There's maybe a slight link mentioned with Cushing's disease, hyperadrenal corticism, but it's usually not a major cause of really high sodium.
Okay, so high total sodium is pretty rare. What about the situation where their sodium level is normal, but they've just lost too much water? That sounds like it could happen more easily.
That's definitely what we tend to see more often. And it can be straightforward, like they just don't have access to water. Or sometimes they have a medical reason where they don't feel thirsty. That's called adipsia, or their thirst is just reduced, which is hypodipsia. Another big one is losing too much water through urine. The classic example here is a condition called diabetes insipidus. And finally, they can lose a lot of water through what we call insensible losses.
Insensible losses, what does that mean?
It means losses you don't easily see, like heavy panting, especially when it's hot out, or if they have a fever, hyperthermia. All that extra breathing and heat radiating off them just pulls water out of their system, even if you don't see it like pee.
Ah, okay, panting makes total sense. We see that all the time. Now, what about the last category, where their total sodium might even be low, but they lost fluids that had even less sodium? How does that lead to high concentration?
Right. This one seems a bit counterintuitive, but it's about the relative concentration. They're losing fluid that contains some sodium, but it's more watery than their body fluids. If they don't replace the water part, the sodium left behind gets more concentrated. We see this with certain kinds of excessive urination, like in diabetes mellitus, the sugar diabetes one, where high blood sugar pulls extra water into the urine, or something called osmotic diuresis, where other substances in the blood draw water out. It can also happen after urinary blockage is cleared. Pets often urinate a lot afterwards. And then there's significant fluid loss from the gut. Think severe vomiting or diarrhea, or using strong laxatives, those osmotic cathartics.
Wow. Okay. So it really is a delicate balance, and lots of things can tip it over. Once it happens, what signs might an owner actually notice at home?
Well, the signs often depend on how high the sodium actually gets. Generally, higher sodium means more severe signs. One of the first things people often notice is increased thirst. They might be hitting the water bowl constantly, drinking way more than usual. The term is polydipsia.
Okay. Excessive drinking. What else?
You might see changes in their behavior, like they seem confused, maybe a bit lost or disoriented. In more serious cases, They can become really lethargic, weak, almost unresponsive. Coma can happen. Seizures are also a major concern with severe hypernatremia. And remember, you might also see other signs related to whatever the underlying cause is, but yeah, that increased thirst and any mental changes are key early warnings.
Definitely things to watch out for. So if a vet suspects hypernatremia, how do they figure out what's really going on? Are there other things it could be?
Oh, absolutely. Diagnosis isn't always straightforward because other conditions can look similar. Vets have to consider what we call differential diagnoses, other possibilities. The references list things like diabetes insipidus, obviously. Also, something called hyperosmolar non-ketotic syndrome. That's a severe complication of diabetes mellitus. Simple dehydration, where they've just lost more water than salts. Really rare problems with the brain's thirst center. And again, that very rare case of actual salt poisoning.
So ruling things out is key. How do lab tests help pinpoint the actual cause among those possibilities?
Labs are crucial. The main finding, of course, is that high sodium level in the blood serum. But other tests help narrow it down. For instance, with diabetes insipidus, you often see them peeing a lot, polyuria, but the urine itself is super dilute, like water. Low specific gravity, we call it. And often, the sodium level in the urine is low.
Okay, dilute urine despite high blood sodium that points towards DI.
Exactly. Contrast that with hyperosmolar non-ketotic syndrome from diabetes mellitus. There you'd see crazy high blood sugar. Often they aren't peeing much, and the urine they do produce is really concentrated, usually a specific gravity over 1.025. And with just plain dehydration, you'd likely see low sodium in the urine because the body's trying to hang on to it, and very concentrated urine again, often over 1.030. So measuring how concentrated the urine is becomes really important.
That makes sense. Comparing blood sodium to urine concentration gives big clues. The sources also mention some drugs or other things can interfere.
Yes, that's a good point. Certain medications, lithium, dimeclocycline, amphotericin are mentioned, can sometimes affect how well the kidneys concentrate urine. That could potentially lead to water loss and raise sodium. Also, a technical point, if a pet has extremely high levels of fat or protein in their blood, some older lab methods like flame photometry might give a falsely high sodium reading. But the references generally state that results from standard human labs are reliable.
Good to know. And what about specific tests if diabetes insipidus seems likely?
Right. If the initial tests point towards DI, the next step is often a modified water deprivation test. This is done very carefully, mind you. Basically, you restrict water access under close supervision and see if the pet's body can concentrate its urine. If it can't, that strongly suggests DI.
And then you try to figure out why they have DI.
Exactly. We can give them ADH antidiuretic hormone or a synthetic version called DDAVP. How their urine concentration responds tells us if it's central DI, meaning the brain isn't making enough ADH, or nephrogenic DI, where the kidneys aren't responding to the ADH that's there. With nephrogenic, the urine concentration barely changes, maybe less than a 10% increase after DDAVP. With central DI, you usually see a big improvement, like a 10%, sometimes even an 800% increase in concentration. And sometimes, for central DI, imaging like a CT or MRI might be done to look for issues in the pituitary gland area of the brain.
Wow, that's quite a detailed workup. Okay, so once it's diagnosed, what's the treatment approach?
The absolute main goal is to lower that high sodium level, but you have to do it slowly and carefully. And of course, treat the underlying cause. Once things are stable, sometimes a lower sodium diet might be recommended, especially for pets with that nephrogenic, kidney-related DI. And I can't stress this enough. Constant access to fresh water is absolutely critical for these pets, especially those with any form of DI.
Makes sense. What if they come in really dehydrated initially?
If they're severely dehydrated, what we call hypovolumic, the first step is usually IV fluids that are balanced, like lactated ringers or normal saline. Sometimes a mix like 5% dextrose and half normal saline. That helps restore their circulation. Then, for the high sodium itself, we use hypotonic fluids that are more dilute than the body, like 5% dextrose and water, D5-LU. The key is slow administration. We aim to lower the blood sodium by no more than about 0.5 milliequivalents per hour, or roughly 10 to 12, maybe up to 20 max, over a full 24 hours. We might also need to add potassium or phosphate to the fluids, depending on their levels.
Slow and steady wins the race here.
Yeah.
And the specific treatments for the types of DI.
For central DI, the usual treatment is DDAVP. It often comes as eye drops given, say, every 12 or 24 hours. For nephrogenic DI, where the kidneys don't respond to ADH-DDAVP, a diuretic medication called hydrochlorothiazide is often used orally. Seems odd to use a diuretic, but it works in a specific way for this condition.
Okay. You mentioned correcting slowly. Why is that so critical? What happens if it's done too fast?
Yeah, correcting too quickly is dangerous. The main risk is causing fluid to shift too rapidly into brain cells, which can lead to swelling, cerebral edema, or fluid buildup in the lungs, pulmonary edema. There's also a potential risk of their calcium levels dropping too low, hypocalcemia, during correction. So, especially in acute, severe cases, we need really close monitoring, checking electrolytes frequently, measuring urine output, tracking body weight, and for any pet with DI, long-term monitoring of how much they're drinking is really important.
Definitely sounds like it requires careful management. What are the potential long-term complications if hypernatremia is severe or not treated properly?
Sadly, severe hypernatremia can have some really serious consequences, particularly neurological ones. We can see things like blood clots forming in the brain vessels, or even bleeding in the brain, that's CNS thrombosis or hemorrhage. Pets might become hyperactive, agitated, or continue to have seizures. The references specifically mention that sodium levels above 180 millieql often lead to permanent brain damage. So, while many pets do recover with the right treatment, the risk of lasting neurological issues is significant, especially in severe cases.
That's a really sobering reminder of how serious this can be. Okay, so to wrap this up, what's the single most important thing you want listeners to take away from this deep dive?
I think the key message is that hypernatremia isn't just a bit too much salt. It's a sign of a potentially dangerous imbalance between sodium and water in your pet's body. Recognizing those early signs we talked about, like the excessive thirst, the confusion, and getting them to a vet quickly is absolutely vital. It really can make a difference in their outcome.
Yeah, and understanding the possible causes, all those things we discussed, can help you be proactive, right? Can make sure water is always available, managing other health conditions properly.
Exactly. And it makes you think, doesn't it? You know, given how critical this one electrolyte balance is, what other seemingly simple parts of our pet's health might have these hidden complexities? It's a good reminder to stay observant, keep asking questions, and just be curious about their overall well-being.